My name is Jason Rosenblum, and I am a patient of Tracey Bryant, PAC, at Trios Care, Chevalo. In August of 2020, during the height of COVID, I was able to get an appointment with Tracey because I was still feeling very tired, weak and hoarse and out of breath. Tracey ordered a series of tests, starting with a referral to an ENT, found nothing abnormal, and concluded that I was using my false vocal cords. After dead ends with specialists, and I was still feeling tired, weak, and hoarse, and out of breath, Tracey ordered a soft tissue CT scan on my neck. My insurance denied the scan, and Tracey took the time to write an appeal letter and explaining why it was crucial I get this. And with the help of her assistant, Heidi, I was able to get the approval approved. I got the scan on October 27, 2021. As soon as Tracey got the results back, they saw a mass in the cricoid cartilage and measured quite large. Tracey, without hesitating, sprang into action and referred me to the University of Washington in Seattle, as she recognized this was a very rare form of cancer. Only a little over 500 cases are ever noted in the cricoid. I finally had the answer to why I was feeling so bad. The University of Washington saw me on November 10th of 2021. Here I was scoped and was confirmed that I had a mass that was growing in my cricoid that showed a larger lesion with calcification. I was told that day the only way to treat this type of cancer, which is chondrosarcoma, was through a full laryngectomy. My wife Denise, God bless her, started looking and researching for alternative answers. She too was finding that chondrosarcoma, a rare cancer, did not and would not respond to chemotherapy or radiation. I met with other doctors at the UW who would help me if I decided to move forward with a full laryngectomy, and what my life would consist of and how I might move forward living with cancer. In January of 2022, I was supposed to have another biopsy at the University of Washington. And while I was in the room, prepped and ready to go for surgery, I was told that I was positive for COVID. The procedure was halted. The primary doctor anesthesiologist came in and said unfortunately they could not do the procedure due to the fact that there was an agreement at the time with the hospital and nurses of positive COVID patients that they would not accept anything going on. I was sent home, which ended up being a blessing. As I was about to hear from Mount Sinai on the way home, we got a phone call. All of November and December, my wife was trying to find alternatives to laryngectomy. After several attempts of reaching out to Mount Sinai in New York, they finally saw that I would be a candidate for experimental surgery instead of a full laryngectomy. As I spoke with my provider, Tracey Bryant, about all my options, she listened closely and for long and many hours and supported whatever decision I was about to make for my medical journey in my life, and would stay in contact even though it was now out of her hands. Tracey was my cheerleader from afar. On her personal time, as I traveled to Manhattan, New York, where I would become the 7th patient in the world to participate in this surgery. It's almost been 2 years now. On February 11, 2022, I had surgery for 18 hours in Mount Sinai, New York, where they first removed my cricoid and then replaced it with my rib, wrapped in fascia from my thigh, and carefully reconstructed and placed my rib in my neck, connecting it to the local arteries. This would be my new cricoid. I would then have a tracheostomy for up to 18 months while I recovered from surgery. It's been almost 2 years and I still partner with the University of Washington, but by far the doctor that has taken most care of me and care for me at this time is Tracey Bryant and her staff. This was a very life-altering surgery, and I cannot help but thank the provider who never gave up on me, knowing me and knowing that I was tired, weak, and struggled to breathe and talk. I could run a mile before I became sick, but I am no longer able to do so because my airway became more restricted due to the surgery. I still find a way to exercise by lifting weights and taking slow walks and living a normal lifestyle as best as I can. I wanted to share my story because I want people to know how important doctors like Tracey Bryant are in life. Without her, I would be suffering an incurable cancer. She really is one of a kind, and her persistence is impeccable. I knew Trios was going to take care of me because Tracey was my provider. Thank you, Tracey, for making sure that I got the care that I needed. You persisted, advocated, referred me, investigated, and looked in all directions to finally learn that I had a rare cancer tumor. I am grateful to have you as my provider for all that you do to champion patient care and second lease on life.
My name is Tracey Bryant. I am a physician associate. I have been practicing here in the Tri-Cities for almost 28 years, and for the last almost 10 of those with Trios. I love helping people. Originally, when I was in my PA program, I thought I want to be in surgery. I did all my electives in surgical subspecialties, and I soon realized that what I really valued was actually taking care of the whole patient. And so started out in emergency medicine, but have finally found my way into family medicine and absolutely love it. Love taking care of the entire family. I have so many families where I take care of the grandparents to their children to their children. I now have patients that I saw as children who are now having their babies, and I get to do their prenatal care as well. It's just, I love it. That is the absolute best part of my job. One of our core values that really resonates with me is to champion patient care. I have lots of examples of ways in which I have been a champion for patient care, but one in particular was a case I had where it goes back to just how important it is for me in family practice and knowing my patients. I had a patient who had a symptom, and we did an initial workup. I couldn't find anything. I then sent him to a specialist. The specialist didn't find anything. He came back to me again, and this just kept going on. I think I sent him to a total of 3 to 4 different specialists. And they all just kept coming back saying nothing's wrong, let's just recheck this in a year. And I just had known this particular patient for so long, and I knew what he was experiencing was not normal. So I just kept trying. We ordered a test. It got denied by the insurance company. My medical assistant at the time really helped me to get that pushed through. We finally got it approved, and then it came back showing a really rare cancer. And I attribute that whole thing to just me knowing my patients and knowing that something was not right with them, and just not giving up, and him not giving up on me, coming back and saying, okay, we didn't get it right this time. What are we going to do next? So it was a really, even though it was a cancer, we found it in time, and it was treatable.